I love the general surgery. I love doing the procedures. And as a fourth-year resident, I was head of the service at Martin Luther King General Hospital. I did a leaking aortic aneurysm with myself and an intern. And I did my first facelift, if you will, as a general surgery resident. As fourth-year resident, one of the services we ran was a Sepulveda Veterans Hospital. Somehow the vets found out. One guy kept saying, "Let me do my facelift, do my facelift." We went and talked to the head of the service and said, "Can we do a facelift?" So long story short, Harry and I did a facelift. I did the right side, he did the left side. And the guy turned out okay.
Welcome to the DIEP End, a plastic surgery podcast. Today, we're honored to be joined by Dr. Sherrell Aston, an internationally renowned aesthetic plastic surgeon known for pioneering techniques in facelift surgery and his influential role as an educator and mentor. Dr. Aston's remarkable career spans over 5 decades, during which he trained at prestigious institutions, was the chair of the Department of Plastic Surgery at Manhattan Eye, Ear, and Throat Hospital, and was president of the American Society for Aesthetic Plastic Surgery. He has significantly advanced the art and science of facial rejuvenation, establishing new standards of surgical excellence recognized worldwide. Beyond his clinical achievements, Dr. Aston's dedication to education and mentorship has shaped generations of plastic surgeons, making him a beloved figure in both academic and private practice settings. Today, we'll dive deep into Dr. Aston's journey, from his rural upbringing in Virginia to his pioneering influence in aesthetic surgery, his approach to innovation, and his unwavering commitment to patient care. Let's dive in.
Well, thank you so much, Dr. Aston, for joining us tonight on the DIEP End podcast. As we talked about earlier, you've been an inspiration to me for a while. And part of that reason is because I knew you spent some time at UVA, and that's where I went to undergrad. I mean, more so than that is the fact that you're a world expert in aesthetic surgery and plastic surgery and just an inspiration to every plastic surgery trainee that there is. But, and Hank, I know you told me the story about how Dr. Aston met your dad the other day, but if you want to share some of your thoughts.
Yeah, I mean, well, first of all, my dad says hello. He enjoyed meeting you in Vegas. And obviously the pedigree of my dad being a plastic surgeon, and I'm now a resident in plastic surgery. Of course, I always heard about you in the household and, someone that we look up to and, want to model our careers after.
You're very kind, Hank. It was great to meet your dad. He's such a great gentleman and great plastic surgeon. So it was my pleasure to meet him.
Yeah.
Thank you. Thank you for your kind remarks there.
So one of the things that we're always interested in, but particularly with you is we know where you are now, and you're at a stage in your life where you are like, you're who I think of as like the New York aesthetic surgeon, facelifts and just world expertise. But I like to think back years ago as to how you grew up as a kid and what kind of kid you were. Did you do anything outside of school? Is there anything back then that might have said, one day I'm going to be a plastic surgeon? So if you can kind of take us back to those youthful years and tell me a little bit about those.
Sure, happy to do that. Well, actually, I grew up in a rural community, a very small village where if you counted pregnant women twice, there wouldn't be 100 people. And I went to a small public school. We had 500 students, and that was grade 1 through 12. And so I grew up in this community. And
what was it called?
It was Holland, Virginia. Mm-hmm. And currently Suffolk Physician, which is a major city now, and they expanded the city. But
I'm from Norfolk, Virginia. I don't think
you know where Suffolk is.
I know where Suffolk is, of course.
Yeah. Okay. Well, I grew up about 10 miles outside of what was the city limits of Suffolk.
Yeah.
In a small village, and my high school was just right down Route 58, 10 miles from Suffolk. And I played football. You wouldn't know it today, but I was about 15 pounds heavier. I was first string quarterback 3 years in a row, and lost 3 games in 3 years, one each year. So, and I played second base in baseball. And so, I had a normal high school experience for a farm boy, country boy. And I went off to the University of Virginia. And that really changed my life in general. My high school guidance counselor, senior year class teacher told me I shouldn't go to the university. It was too big. I wouldn't be able to make it. But I guess she gave me a lot of stimulation to go do that anyway.
Yeah.
And so I was at University of Virginia for undergraduate school and medical school. I knew I was going to medical school. If you ask me what you're going to do when you grow up, when I was 6 years old, I would have said I'm going to be a surgeon. Why? My paternal grandmother had melanoma. She had a lot of surgical procedures. And I heard about surgeons just about every day. I don't think I knew what the heck a surgeon was, except surgeons were taking care of my grandmother. So when I graduated from high school, I went off to the University of Virginia with the idea I was going to be a surgeon. And things changed from there, as you might imagine. My transition to plastic surgery came during my senior year in medical school. So let me tell you about that.
Yeah. First, I want to just interrupt and say,
ask me. You interrupt me anywhere you want to, because I'm happy to talk about everything.
2 things. First off, growing up in Norfolk, Virginia, the history of Eastern Virginia Medical School and the legacy of plastic surgery there is something that kind of sparked energy in me for the longest time, because are you familiar with like the history and the legacy of the people at EVMS?
Oh, sure, absolutely. You knew Jim Carraway, no doubt.
Oh yeah, of course. Yeah,
Jim
he operated on me. He did something on me. I don't know what he did, but it's something as I was as a kid.
Jim Carraway is a great friend.
Yeah,
still is, and Dr. Horton, of course. And so
Horton, Charlie Horton did this.
Yeah,
removed
he
a
did
cyst
that.
from underneath my eye.
Yes. So they had a great reputation, obviously, as plastic surgeons, but they came along a little later in my life, as you might imagine. Yeah.
Yeah. So at UVA, I went to UVA, so I kind of know a lot about the school, and as academic as it is, it can be a lot of fun as well. So did you have fun there? Were you in a fraternity or anything like that? Or did you stay pretty academic focused?
Well, both. I was an SAE. What fraternity were you in? You're in a fraternity?
Kappa Alpha.
KA. Yeah, you're a great KA. Well, KA house was next door to the SAE house when I was an undergraduate student, just off Rugby Road. You were
exactly
Rugby Road. We were on Great Avenue.
Yeah. Hank, you got to come. There's good wine. There's great wine tasting.
Invite me. I'll be there.
Yeah, it was great.
It's a special place.
It is a special place. Well, I was a very determined student because I got there, growing up in a small community. I got there with guys who've been to boarding school and, sons of New York investment bankers and all this stuff, which was a totally different world for me. I mean, you in Norfolk, you're in a big city, and a little bit later than I was. Remember, I was went off to UVA in 1960. So it was a great transition, but I worked very, very hard because I knew I wanted to go to medical school. But at the same time, I enjoyed being in the fraternity. I was involved in university politics, if you will. The 4 student officers, are usually fourth year guys. I was one of the 4 officers in our class, and so I combined, very aggressive academic work with trying to be a good student. Yeah, I had a lot of Turner brothers who had a lot more fun than I did, but I shouldn't say that. I'd say they approach life a little differently than I. So I did work very hard because I wanted to get into medical school, and I knew at the end of the third year I was going to be going to medical school at the university, and so there you go.
And I know you said from early on you knew surgery was your path, but
Yeah.
I'm curious about your early influences of maybe other types of surgery, or when plastic surgery emerged as what you were going to be.
Yeah, sure. Well, as you know, in the 60s, cardiac surgery was the big thing.
Yes.
And you know, you had Christian Barnard in Cape Town, and you had Denton Cooley, you had Michael DeBakey in Houston, and cardiac surgery was in its early days. And I thought I was going to be a cardiac surgeon, and I used to go watch cardiac surgery. Where were you in medical school after UVA?
Yeah.
So I went to Eastern Virginia, actually. My dad was on faculty there.
Got it. Okay.
Yep.
Well, you know, there was an observatory. You could look down in the cardiac surgery room and watch the cardiac surgery. And when I couldn't get in the room, I was upstairs watching cardiac surgery. And I just knew that I was going to be a cardiac surgeon. As a matter of fact, that was in the early days of the matching program for internships. And I decided, for whatever reason, I wanted to go to the West Coast, do something different. I'd looked at all the programs, and I wanted to go to UCLA. The chairman of surgery at Virginia and the chairman of surgery at UCLA had been at Hopkins together, and somehow I matched as an intern at UCLA. Everybody knew that Aston is coming and he's going to be in our cardiac surgery program. And I was scheduled to do that until May 28th, 1968. That was last Friday in May of my senior year in medical school. We had a visiting plastic surgeon from Richmond came to give the first lecture. It's the first time I'd ever heard anything about plastic surgery. And he spent most of his time talking about things he had done in Vietnam and showing reconstructive procedures, etc. And in about the last 10 minutes of his surgery, he started showing aesthetic surgery. And when I walked out of that room, I knew I was never going to be a cardiac surgeon. It's sort of like, you know, it's sort of like, you know, when you fall in love the first time.
Yeah.
Yeah.
You know,
Hank definitely knows.
Yeah. Hank really knows. I got it. I got it. But you know, it grabs your heart.
Yeah. But you know what's funny is that out of 27 episode releases, Hank, like probably a third of the guests have said cardiac surgery.
Yeah, you're not the first. A lot of people have said that too.
Is that right?
Yeah.
Well, I just knew when I walked out of there, I would not be a cardiac surgeon, that I'd be a plastic surgeon. So when I got to UCLA, I knew that expressing that desire out loud would not be very productive towards me winding up as one of the 5 chief residents out of 25 interns. A very Halstead type program. So I went to work, trying to be a good intern. But I reviewed all the cardiac valves that had ever been put in at UCLA, along with Don Mulder, who was the head of cardiac surgery. That had not been done before. And published that paper, and for some reason he put my name on the paper first. And that cardiac valve paper was greatly received and repeated in cardiovascular surgery journals and talked about. And Egdahl and Mandel put it in as their cardiac paper of the year in their hardback book and all that sort of stuff. And by the time we got that in press, I went to the chairman of the department, who was Dr. Longmire, who's a big pancreatic surgeon, as you know. And I said, boss, let's talk about the statistics. Let's review all of the whipples that have ever been done here. Okay, Aston. Okay, let's do that. And if you got the time, those two papers stood in my favor a great deal. But long story short, somehow I was appointed as one of the chief residents, and the policy at UCLA at that time was, if you're chief resident, once you knew you're chief resident, you had to either go to Mayo Clinic or Johns Hopkins for 6 months, because Dr. Longmire, appropriately said, you need to see a different culture. You need to know something besides what we're doing here.
Mm-hmm.
Having grown up near Baltimore, Suffolk, not so far from Baltimore, right? I went to Hopkins for 6 months. So that got me there.
I'm curious, when you internally pivoted from CT surgery to, I want to do aesthetic plastic surgery, did you have to wrestle with that? Or I know you fell in love for the first time and you knew immediately, but all the other things that you've already put into motion, did you have to wrestle emotionally with that? And obviously aesthetic surgery back then, it wasn't perceived as it is now, where everybody wants to do it, whether you're a plastic surgeon or not. Back then, obviously, it was a little bit more radical.
You're absolutely right. And the last thing you would want to do back then was say, I'm going to just do aesthetic surgery, which I did at the end of my plastic residency, or actually about halfway through. I made it known at UCLA I was just going to do aesthetic surgery. We can talk about that a little bit later, maybe. But no,
yeah, I definitely want to hear about that.
Yeah, okay. But no, I once I knew, when I fell in love, I didn't have any internal conflict, except I didn't want to I didn't want to have the leaders, the chairman, to be upset with me, and that's why I did the cardiac valve paper. That's why I did the Whipple procedure. I wanted them to understand that I was a serious surgeon, and I guess that I knew inside I couldn't not be a plastic surgeon. So I had to go where my feelings were, but I felt an obligation to not disappoint my chairman at UVA, who may have helped with my matching at UCLA. And, I didn't want to disappoint anyone, but I knew life is hopefully long, and you needed to do the things you have to do and contribute as much as you can along the way. So,
of course,
so I didn't know. I knew what I had to do.
Yeah, it reminds me a lot. Not much changed over the years, because I was at Hopkins for general surgery, very old school, with John Cameron walking the hallways and Paul Manson walking the hallways. And when I almost committed career suicide and admitted that I wanted to do plastic surgery amongst a bunch of general surgeons, I still wanted to make it known that I was a hard worker. I was still the hard worker that they hired. I didn't want them to think, oh, now Saїd is going to do plastic surgery. We could have seen that all along. And so I still put my heart into, my goal was to still be the best resident, so that just like you said, you don't have that kind of shadow as going into the plastic surgery as a stepchild in the future.
Exactly. So I love the general surgery. I love doing the procedures. And as a fourth-year resident, I was head of the service at Martin Luther King General Hospital. I did a leaking aortic aneurysm with myself and an intern, and gunshot wound to the chest in the emergency room, And of course, we did a lot of other cases. I did my first facelift, if you will, as a general surgery resident. As fourth-year resident, one of the services we ran was the Sepulveda Veterans Hospital. And and Harry Glassman, who was 1 year behind me, who practiced in Beverly Hills for many years, were on the service together. And as we'd make rounds every morning, somehow the vets found out we were doing serious surgery, but we also both had an interest in plastic surgery. One guy kept saying, "Let me do my facelift, do my facelift." We went and talked to the head of the service and said, "Can we do a facelift?" He said, "Well, you guys know." Yes, I know how to do a facelift. Because Franklin Ashley, who was chairman of plastic surgery at UCLA, did 2 facelifts in his office at Beverly Glen Hospital every Saturday morning. And when general surgery rounds were over, I'd shoot over to his office and he'd let me watch over his shoulder. So long story short, Harry and I did a facelift. I did the right side, he did the left side. And the guy turned out okay. But, we just did a skin lift with a little plication kind of thing. But that's how we got through the general surgery residency and on to the plastic residency. But when I was applying for plastic surgery residency, unless you were board eligible or going to get your boards in general surgery, it was worthless to apply to NYU because they're only taking people who are going to be double boarded. I knew that was part of the deal, but I had decided that NYU was the place that I wanted to come for my aesthetic surgery training.
Mm-hmm. And what it's funny. I mean, going to New York with a Southern accent probably wasn't easy. But
it wasn't easy. I'm right,
surprised you were able to maintain it for so long.
Well, it just sort of sticks there, But
yeah.
But coming from UCLA, I arrived in NYU. It came early morning. I came through the cafeteria line. I had on my bell-bottom pants and my platform shoes, and I saw a couple of the general surgery residents punching each other's elbows and nodding towards my feet because this was not normal. A day later, Dr. Localio, who was head of the general surgery department, if you will, was walking down the hall with his entourage. Just before breakfast, they were making rounds, and Dr. Localio stopped me and said, "Are you Dr. Aston?" "Yes, I am." And he said, "Well, the paper you published with Bill Longmire and those Whipples." So I got some street creds with his entourage. And 2 days later, I'm walking down the hall, different floor, and there comes Dr. Spencer, chairman of cardiac surgery, with his entourage, right? And he stops me, same thing, says, "Are you Dr. Aston?" "Yes, sir, Dr. Spencer, I know who you are." He said, "That paper you did with Don Mulder was pretty fabulous on all those cardiac valves." So you know what?
Wow.
That's why I say that the pancreatic surgery paper and the cardiac valve paper gave me street credibility. Well, with the general surgeons at NYU, so it's all worked out to be worthwhile, so to speak. It's all been fun. It's just been a wonderful.
And it's fun. It's fun seeing you smile about it. I'm sure, Hank. One of the things that because I want to hear from you too, Hank. But one of the things that I'm so curious about, because you express so much love, and you can tell you smile and you light up when you talk about it. What made you think, have developed that love for aesthetic surgery? Like, what did it for you?
I've thought about that. I don't know exactly, but I felt it inside. I felt it in my heart. I wasn't kidding when I said, when you fall in love for the first time. My mother was an artist. She painted extremely well, but I thought I had some dexterity with my hands, but I guess it was the need to combine some of the aesthetic sensitivities that maybe I didn't even know I'd picked up from my mother, but just observing her and thinking my hands were useful for something. It just sort of, it fell in place together. And just, it sort of, maybe sort of silly to say, I just fell in love with the idea of being able to do something that made people look better than nature had intended for them to be. That's why it's been such a pleasure all these years.
Yeah. And obviously, it's still so palpable as we're listening to you, and you're smiling and you're still so excited. What continues to drive you to stay on top of your game and to learn new things? And what kind of excites you to keep doing this?
Well, there's several things that excite me to keep doing it. One is I'm always, and even today, every patient that you do an aesthetic procedure for comes to you because they think you can make them better than they are in some way. That you can do something for them that makes them better than nature had intended. And there's a certain amount of enthusiasm in their thought processes, and while you may see, X number of patients in the course of a day, for each individual who walks into your office, this is a huge experience. You talk about it, you may talk about that patient. If a special situation, you may be talking to your colleagues about it, may show it at the meeting, some before and afters, or talk to your staff. But this is a very intimate part of an individual's life. And every word you say in a consultation, everything that you tell them you can do, can't do, etc., they are repeating to members of their family, their close friends, and they're thinking about it when they get into bed at night, And so this is a very unique experience for the individual patient. So I see this as a responsibility that I have to deliver for this person something that makes them happier inside about what it is I can do for them. And I think that the chance of possibly doing that, when you guys are plastic surgeons, you evaluate patients and you look at them and you say, well, I can do this. I know I can do that, change this, make this better. Sometimes you say, no, I can't make that any better. But I think feeling how you feel about what you can do for the individual is a key component of why you just keep doing it. Sometimes people say, oh, you're plastic surgeons charging a lot of money, whatever. As far as I'm concerned, that's important. The financial transaction is the least important part of the whole process for an individual. I think it making them happy and feeling good about it. Don't you guys feel that? I'm sure you do.
100%. I mean, I appreciate so much what you just said about the patient interaction because, I do a lot of breast surgery, breast reconstruction, and lifts, et cetera. But unfortunately, as a human, we all get into this rhythm where we do it so frequently that we lose sight sometimes of how special that interaction is for a patient. Like every patient, it's first off, it's something that they will see, we will see, everyone will see in terms of like aesthetic surgery or reconstructive surgery. So it's such an important thing that you're doing for them. And I just so much appreciate what you just said, because I think every once in a while we just have to take a moment and step back and say, even though we do these operations every day, multiple times a day, for each individual patient, it's their first experience and it's a life-changing experience.
Oh, it is indeed. It is a life-changing experience.
Yeah.
Yeah. Now this question might be a little bit more technical, but I'm just curious because obviously I've heard you coined as the king of facelifts in America, or the facelift king of America. I'm curious, over your career, what has changed about how you perform the facelift, or what we know technically about the best way to do a facelift? Has your technique changed, and how do you stay on top and continue to adapt?
Well, a couple things. First of all, Facelift King of America. If you believe that stuff, it's time to stop working, because when you start believing things like that, you're going to start to not deliver the results that you really want to deliver. So,
Mm-hmm.
while I've operated on thousands and thousands of patients, I treat every case as if it's the first time. To me, every facelift, people say to me, how difficult is my nose, or how difficult is my face on a scale of 1 to 10 or whatever. To me, everything's a 10 until the bandage is on. And you shouldn't think any differently. But see, I came along in that sweet spot in the development of facelifting. We went through a period from, about 50 years where there was no real developments in facial aesthetic surgery. There were people doing skin undermining and a little bit of plication. And Dr. Reese's textbook, and by the way, Dr. Tom Reese was the reason that I wanted to come to NYU for my plastic surgery training. And his textbook, published 1973, shows skin undermining and a little plication in the cheeks. And so in 1976, the Aesthetic Society had a facial aesthetic surgery symposium in Denver. I was there. And I saw that what Bruce Cannell, Rex Peterson, Gross Santos were starting to do, some things they were doing with platysma in the neck. And I came home on Sunday night. I did a facelift on Monday morning at NYU, skin undermining and a little plication. Went over to the cadaver lab, or the morgue really, at Bellevue Hospital. Managed to wind up with a cadaver. And I spent really wee hours of the morning learning the anatomy that I really did not understand at that point in time. And Thursday, just 3 days later at NYU, I did my first platysma SMAS facelift procedure with undermining of the platysma and the SMAS in the face, but we did not go through McGregor's patch. That was sort of a no-no then. So we were leaving, the zygomatic ligaments, portion masteric ligaments were not taken down, but we had very wide SMAS and platysma undermining. So I was at the right spot, and over the next 15 months, I accumulated 75 facelifts that I had a drawing of every case on, so I knew exactly what I did, the different things I did to the platysma muscle. And so the progression that we made starting about 1980 was going after the mid-face, if you will, taking down the zygomatic ligaments. And that's, Samra's deep plane facelift was actually published in 1990, but it was really in 1980, 81. I still have slides and pictures from those days of intraop pictures as well as the patients, starting the upper portion of the dissection into the deep plane, if you will. Sam coined the term, as we all know. Well, we were already in that plane, but the skin and the SMAS were undermined as separate layers, as many, many people do today.
Yeah, I think, that's the perfect segue to the thing that I'm about to ask you, which I'm so curious about, because maybe Hank is thinking the same thing, but a lot of people are thinking that like the deep plane facelift is like just a new marketing tool. It's like, oh, I want to go to somebody who does a deep plane facelift. Like this is like the new type of facelift that I have to get. What's your thought on that term now that everyone's kind of just throwing out, and everyone now wants the deep plane facelift?
Well, it is true because that the marketing has been a central part of deep plane facelift. But let's just stop and think anatomically what we're talking about. You know, once you get under the SMAS, if you lifted up the entire SMAS and go over it, go on top of the zygomaticus major muscle, take the fat off, you are doing what the plane that Sam Hammer was in and published, as I said earlier, in 1990. It has been marketed through social media as if this is a totally different operation. And today, there are a huge number of variations. The meeting that I was in Vegas, where I met your father, Hank. I was on a panel, and there were 4 deep plane facelifts presented right after my talk, and I talked to them about the history, et cetera, et cetera. And each of the deep plane surgeons were doing their modification, their particular form of the deep plane. Now, everybody to be in the deep plane, you've got to get under the SMAS, but where you enter under the SMAS, et cetera, varies from surgeon to surgeon, as you all know. You read the literature, you read everybody's paper, you see people doing deep plane, but that is embryologically a cleavage plane, so that when you get in that deep plane, whether if you've got the skin attached to the SMAS, you're lifting everything up. You've got all the soft tissue up. Now you're on the cervical fascia. You're looking at your facial nerves, and so you can't get any deeper plane than that. And I think I don't have a facelift technique. I mean, I started doing something that one of my fellows said, you should call this a FAME. And what? He said, phagocysteal malar elevation. So FAME was born, but I was already in the deep plane, if you will, doing the procedure. And I have to credit the fellow for saying you should call this the FAME. But anyway,
that can be like the next marketing thing.
I was going to say, Saïd, we should just call it the DIEP End facelift instead of the deep plane facelift.
DIEP End facelift. And Sam, Sam Hammer finished the residency the year I got at NYU. And he and I used to debate techniques, etc. And we had some pretty vocal debates at aesthetic society meetings and various symposia. And, we each got a little hot, I guess, from time to time. But a few years ago, and Sam and I were at a meeting in Moscow together. And around midnight one night, we happened to be in the lobby at the same time. And we shook hands, and Sam said, I'm sorry that we sort of had some heated discussions back then, and then we both realized it was academically important to
of course.
Are you allowed to speak? Opinion. Are you allowed to speak upon how your philosophies differed?
Oh, well, the main thing was that Sam, if he's in the deep plane, he was leaving the skin attached to the SMAS. Mm-hmm. And what I did and what I do today, depending on the patient, is it's bilamellar. The skin is one layer and the SMAS a separate layer. So we argued back and forth about which was the best result. And I think there's room for all the procedures, and I think there are patients where a composite, I think it's better just call it a composite versus a bilamellar. And I think there are places for each of those. And I do everything. I do, I don't do any skin, just skin underminings. Or at least I haven't for many, many, many years. But I do a lot of bilamellar procedures. There are few patients, particularly secondaries, tertiaries, where the only thing you can do is maybe some imbrication, because you're already looking through a thin SMAS, particularly just anterior to the parotid. You're looking at the facial nerves through 2 or 3 cell layers and those sort of stuff. But for the primary facelifts, and I vary that based on my sense of the anatomy of that individual and how I'm likely to get the best result.
Right.
So I think there's no one facelift technique for all patients. I'm sure you guys agree with that.
Of
Jim,
course,
Yeah.
it's
same
patient
thing?
specific. And now,
Yeah.
obviously, with some less invasive or non-invasive devices, or like radio frequency type stuff, has that changed how your consultations go with certain patients? Now that you can offer different things that you weren't able to offer back in the day.
Yes, and I do some radio frequency microneedling, but I tell the patients that you won't get rid of all the wrinkles. I can make your wrinkles go away faster with laser, but your healing time is going to be significantly longer. And 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 the fact is, if you laser people deep enough that you're going to get rid of the wrinkles, a huge percentage of the time, you're going to look at them a year out, year and a half out, you'll have a little depigmentation too. Right? If if you take dark skin, you may wind up a little darker too. But I would say, when I go back, I've spent so many hours at night sitting at this desk looking at my before and afters. The truth comes out, at 11 o'clock at night when you're picking those pictures up and putting them down and saying, this is what I did to this patient. This is the result I got. That looks a little bleached there. Maybe, lost a little pigment. And so you learn these things over the years. And I tell patients that. I said, I can do laser, make your wrinkles go away faster than I can with radio frequency. But we run the risk of a little hypopigmentation. Of course, there's some good lasers now that you can get good results with maybe less.
Mm-hmm.
But remember, I was there at the beginning of the CO2 lasers, which had a rather long healing period with them.
Yeah. Is there, before we ask you more about your career, is there like a sweet spot for this is the number of facelifts I want to do a week where I'm not overburdened, but I'm still offering a good result? And what does your kind of wait list look like?
Well, we fortunately are busy, but listen, when it comes to wait lists, I think that's ego building. My philosophy has always been that if your schedule is full next week, that's all you need. And fortunately, there were times that I've done 4 facelifts in a day. Certainly, the facelifts we were doing at that period in time, when today's facelifts are not just facelifts. You got fat grafting.
Yep, exactly.
And all the other things that you do. So the amount of time it takes to get the procedure done and do it the way you want the result to be, just is a longer period of time. But at this point in time, I'm happy, working as hard as I did 30 years ago. I mean, I've been very,
You're still
very
smiling. You still have a big smile. So,
well, listen, I've been very lucky, guys. In July 1, I will have been in practice 50 years.
Wow.
So I feel very good about that. But listen, Michael DeBakey operated for 75 years, I think. So he retired at 90, I think. Stopped operating.
Wow.
I'm not saying I have.
And that's
that
doing
as a
heart
benchmark.
surgery.
Yeah, it's doing heart surgery. But you all know that heart surgery and facelifting are different. But I'm not sure that the stress is less.
Oh my gosh. No, you see your results. You can't hide them, especially on the face.
That's exactly right. Yeah. So I don't have a benchmark. I don't have a time frame working on. The powers that above me may decide I'm not working tomorrow, for all I know. But the bottom line is, at this point, I'm lucky. I'm in good health. I work out, try to do it every day. I'm doing it at least 6 days a week. But
Well, we're going to have to ask you about your workouts in a little bit, but one of the things I want to, I'm curious about, president of ASAPS, numerous prestigious awards, director at Meath. One of the, even myself as a general surgery resident, I used to know about Meath and aesthetics and your name. If there's one thing you could probably say, this is something that I'm most proud of from all of those, big events, president of ASAPS, program director at Meath, et cetera. What do you think you're most proud of?
I'm very proud to be a member of the plastic surgery department. It's made significant contributions to this specialty of aesthetic plastic surgery. Since the time I was president of ASAPS, other members of our department have been president of aesthetic surgery. Fritz Barton, Dan Morello, Franklin Espaltro, Bob Bernard, Jim Stuzen, Charlie Thorne, Dr. Jennifer Walden. Dr. Jennifer Walden, the first female plastic surgeon to become the president of Aesthetic Society. Right person, right place, leadership qualities, excellent surgeons. In fact, after she finished the fellowship, she stayed in New York as my associate for 8 years before she returned home to Austin. And then now we have Tracy Pfeiffer who's doing a wonderful job as president of Aesthetic Society. She was one of our residents at NYU. But it's not just those members who've been president of the Aesthetic Society that we're proud of. It's the many fellows and residents who credit our department, not just me, credit our department with being significant in their education of aesthetic plastic surgery. And now they've gone out all over the country and established wonderful practices and are delivering excellent results for their patients. We're very proud of our trainees in aesthetic plastic surgery.
Yeah, it's funny because just thinking back to everything we've talked about so far, and just Hank and I have had these discussions before about academics, and when I listen to you and the way you are so driven, so hardworking, and the thought, some people think it's almost like when you go into private practice or if you go into aesthetics, it's almost like, are we losing this person to the dark side? But you are somebody that I still always think about still having that large academic role, interested in teaching, interested in giving back, et cetera. What do you have to say about, the fact that private practice doesn't involve teaching, if you understand what I'm saying?
Right. Well, let me tell you how I got here. I declared after the first year of plastic surgery residence, I let it be known that I was going to do aesthetic surgery. And so I told you I came to New York because of Dr. Thomas Reese. But at Manhattan 90, we had Tom Reese, we had Carrie Guy, we had Mike Hogan. We had people who were just doing aesthetic surgery. So I went to Dr. Converse. Well, first of all, back up a second. About 6 months before I finished my plastic surgery residency, Dr. Reese, who was watching and what I was doing, and I did a lot of facelifts. I did 63 closed rhinoplasties, and I talked to Dr. Reese about this result. I asked him questions. He says one day, "Look, if you want to stay in New York. See if you can get your practice started. We'll have plenty of room and because we bought the townhouse next door, cut the wall out, and we got empty space. Come join us." And I said, I think I would like to do that. And I said, I want my own phone number, I want my receptionist, and I want my own nurse. And he said, "Sherrell, that's not a problem. Do whatever you want." So I had a phone put in about a month before I finished my residency. I hired a receptionist and a nurse. And he put that my receptionist was next to his at the front of the office. So we had a very good working relationship. But once he had said that to me, I went to talk to Dr. Converse, and I said, "I want to stay in New York. What are you going to do?" I asked him. I said, "I'm going to just do aesthetic surgery." And he said, "This is no disrespect to hairdressing, because at the rates they're charging today, it's a good profession." He said, "I don't want you to be a hairdresser." I said, "I promise you, Dr. Converse, I will approach aesthetic surgery from an academic standpoint, just the way you have craniofacial surgery. Promise you, I won't embarrass you. He said, you've got to be on the faculty. So that's how I wound up staying in New York. I had no intentions of coming to New York. I was going to go back down south. But it was the only place at that point in time that you could blend pure aesthetic practice with academics, as I saw it.
Yep.
So consequently, that paper that I said, the platysmal procedures, I published those 75 patients in 79, having started on those cases in 76, so, like a year after finishing residency. So I was always wanting to be part of the academic community and try to give back if teaching was possible to do that. But you guys are doing that every day.
Yeah. So obviously you were a pioneer and way before your time with a lot of this stuff. But fast forward to now, and we have, we're in a time where our most prestigious journal, PRS, has a cosmetic section, or we have the aesthetic surgery journal, and we have aesthetic fellowships. So now that a lot of our residents have the luxury of not having to hide it or able to include aesthetics in the same definition of academics, what would your advice be to a resident who wants to pursue aesthetic surgery and be the best aesthetic surgeon they can be? What would your advice to them be, and how to achieve that?
Well, the first thing you want to do is try to be in a position where you got very good training, and you need to do an aesthetic surgery fellowship. You could go and practice and be okay without it. But if you can get an aesthetic surgery fellowship, it'll give you an experience that'll help you with your first years in practice. The paper that I mentioned, published in Annals of Plastic Surgery, I submitted to PRS, and it was turned down by McDowell. I got a letter back saying there's no suggestion that this platysma and SMAS procedures are going to be of any benefit in facelifting in the future. And so you're right. PRS has changed, right?
Yeah.
But I think that training is key. I think exposure. And if you don't have an aesthetic surgery fellowship, you go and visit a lot of people who are doing aesthetic surgery and watch what they're doing. And I think when you watch someone else operating, you have to really mentally absorb each of their little moves, all of their movements, because a lot of things will go over your head if you're not. You got to stay laser focused on what their hands are doing. And I'm sure you guys agree with that. You can watch somebody operate and finish and still not know all the details that you're going to want to use when you're doing your own case. So I think it's important to get as much education as you can. And every time I go to a meeting, I'm learning some things. The meeting in Las Vegas 3 weeks ago, it's a combination of plastic surgeons, dermatologists, facial plastic surgeons. I learn from everybody. I try to come away from every meeting knowing something that I didn't know when I got there.
Yeah. And that takes me to my next thought. It's, when we reflect back on everything that got us to where we are, obviously there's a lot of highlights. Is there any regret that you have in mind that you're like, if I could go back, to 30 years ago, 40 years ago, 50 years ago, I would probably have done this a little bit differently?
Not in terms of just a strictly surgical practice. I think I would,
or just in life.
Yeah. Well, the one thing I would have changed in the building where I am now, I have my office, my surgical facility here. If you go out the back door of my office, you go in another office, which faces on 71st Street. It's an office that I own. I had a spa there in the 1980s. I had I had a medical spar with estheticians, a PA, a nurse, and it was a bit ahead of the time. And we had a lot of makeup products and all this
Mhm.
sort of stuff. But
Yep.
it was so much ahead of the time that you couldn't wrap your arms around it the way you do today. The only real injectable was a collagen. And, the authorities weren't really happy that nurses had started injecting something, and so in the surgery practice was consuming night and day. So I eventually just closed that business. So if I were doing it over, if you say, what would you do there? I would keep that going rather than
Yeah.
close it down, because it's such an integral part of practices today.
Yeah,
But
you're so right.
yeah,
Some of the things that we kind of are some of these last questions are kind of quick shots, but you talked about working out and how you work out 6 days a week, which makes me need to work out after this podcast. I'm going to go for a run or something. But
I will too.
what's your favorite thing to do when you're working out, or like your favorite workout activity? And typically, like what does like a day or week look like with that?
Well, on Monday, Tuesday, and Wednesday, we're operating, and so I don't go to the gym in the morning, but I go tonight. I will go to the gym tonight, probably around 9:30, and I'll be there for about an hour and 15 minutes, based on yesterday's workout.
What time do you wake up in the morning?
Well, 5:30, 5:45.
Wow.
What we're doing. But yesterday's workout had a lot of aerobics, because Friday and Saturday had aerobics, but mostly weights. Yeah, yesterday and was primarily aerobic, and some abs, but and aerobics yesterday included actually jogging in water that's up to here for an hour nonstop. It's as fast as I can. I have a pool that's reasonable width, and so
That's a good workout. Yeah.
it is. It's amazing workout. And tonight we'll be back to doing mostly weights, and in about 10 minutes of elliptical, pretty fast, and then that get me ready for tomorrow.
Do you have a personal trainer? Is this like your own gym, or are you part of a gym?
I have a gym in my house in Long Island. That's a pretty decent gym, and in the building I live a block from my office. So
Okay.
In the basement of our building where I live, we have a very nice gym, which has everything. And the other thing is, at 9:30 at night, there's nobody else there.
Perfect.
Yeah, that's true.
So, but I think that's an essential part of your life as a surgeon. I think staying physically fit is very meaningful to a young surgeon. It's easy to put that off after a long day, but I think that keeps you going.
Yeah.
Do you find that like sorry, Hank, I have to ask about it. Do you find that like a late workout gets you tired for the next day at all?
No,
you think it helps
energized. Energized for the next day. Sure. Your arms, your legs, your back, your shoulders, all the muscles. I don't sit down to do facelifts. I stand. A lot of people sit to do the faces. I stand for 100% of what I do. I think you just keep your body in good shape.
Any other hobbies other than working out and plastic surgery? What else do you like to do?
Well,
it doesn't sound like there's that much more time.
Yeah, there isn't that much time, but
well, I have a wife and two daughters who are 20 years old, and the time that's left over, you're right, it's not a lot of time, because putting lectures together, as you both know, that eats up a lot of nights and a lot of weekends. So keeping it all together and doing those things that need to do professionally as well as personally. I just try to blend it all together. And yeah.
Do either of your daughters want to do plastic surgery?
No. And I have three sons. Two of those are bankers, and so that no. My sons are older than my daughters by a good bit, but no, nobody wants to be a surgeon. But I have a grandson who's thinking about the possibility of being a surgeon. So I heard recently.
Well, I have a feeling they might be a little well connected, so that hopefully they go in that direction. Go ahead, Hank.
And thank you again, Dr. Aston. This has been incredible. We've learned so much. Our audience is going to love this episode. A few more questions, and then
sure.
In the OR, do you listen to music? And
yes.
What do you listen to?
Country.
Nice.
Yeah. How does that take it in New York? The OR nurses must. Well, I guess they're probably your OR nurses, so they have to do whatever you want.
They know that's what we're doing, and I like everything. Don't get me wrong. I like it, but mostly we're playing country.
Yeah, I like country too, and Hank in Philly, I feel like I hear it in a lot of ORs.
Yeah, I think slowly more and more people are accepting of country. I know I love country, so.
Yeah, I met Willie Nelson when he's here in New York. We sat around, talked for about 40 minutes one night.
That's amazing. What did you learn from him? Did you learn anything from him?
Learned he was just a great gentleman. Long story short, he was playing Radio City Music Hall. Met through and my wife knew I always said I'd love to meet Willie one day. Through a connection of hers, I sit down and for opening act, and a lady comes and taps me on the shoulder and says, Mr. Nelson said, come backstage at the end of the show. I said, okay.
Were you which Mr. Nelson?
She knew I knew. And I looked at my wife and I said, you had something to do with this. Yes, I did. So about just a few minutes later, same person taps me on the shoulder and said, Mr. Nelson said, at the end of the show, it's too crowded backstage. He said, come on back with me now. He's coming off the bus, which was parked right outside of Radio City Music Hall.
Oh, my goodness.
He'd come, we go sit down in a room and talk for about 40 minutes. They come and knock on the door and say, Mr. Nelson, you got to come on. He'd say, I'll be there in a minute. And the second knock on the door, about 5 minutes later, he says, all right, Doc, I got to go out here and make a living. But he's a country guy growing up in Texas. Very, very, very nice. And he was wondering how a guy from Virginia wound up in New York. But he was really nice. And I met George Jones when he was in New York. But that's another story. But it was all good.
Yeah, it's funny to think about coming from the South and ending up north, but my wife and I are both from Norfolk. She actually went to UVA too. She's actually from Nancock, Virginia, which is more really the southern part of Virginia. So, but it's been a lot of fun.
Where are you from, Hank?
I'm not from the South. I'm from South Jersey, right outside of Philly.
South Jersey.
Yeah, so South Jersey.
That's not way different.
South. But my girlfriend's from Alabama. So she's got the Southern accent a little bit. I
see. Well, I think once you have it, it sort of sticks.
Yeah. So, and then what advice do you think you would give your 25-year-old self?
Well, it 25, that would be 1967. In retrospect, it would be just what I did. Pursue what your heart tells you to go after, because if you don't, you're not going to really be happy in life. You don't want to look back and say coulda, woulda, shoulda. We all have some of those. Man, I've got a long list of those too. But I think in terms of doing the profession you want to do, you got to pursue what's making you happy.
Yeah.
Yeah. All right. Should I ask the last question?
Yeah, ask the last question.
The last one is just, what's your favorite surgical instrument?
Scalpel.
As any surgeon should say.
Yeah, you can do a lot of things with a scalpel.
Yeah.
Any specific blade?
10.
10 blade.
You can't give away all his secrets, Hank. Come on. So this has been a ton of fun.
Well, it's great for me. I think that you gentlemen are in an academic community. I think the fact that I think sharing what we know with some younger people, particularly the fellas that I've had over the years, have been, brought me a great deal of pleasure seeing them develop practices and go on to heights of their own. And I think that's one of the great rewards we get out of the academic side of plastic surgery. And I'm fortunate they've had some fabulous fellows.
Well, awesome. Well, thanks again for joining us.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.